Hello, everybody, and a warm welcome to this 8th webinar in the World Gastroenterology Organization series on climate change, named WGO Climate Course for Global Gastroenterology. It is a real privilege for me speaking with you today, as we have very important topics to address, including the perspectives on trainees and early career digestive health providers, along with the global pediatric health perspective. We should never forget that as the twig is bent, so grows the tree. My name is Guilherme Macedo, the current World Gastroenterology Organization president, also president of the Portuguese Society of Gastroenterology, where in fact we recently began our increasing awareness program on this urgent, fascinating, and emergent topic. I am fortunate to have a distinguished group of moderators and speakers today, and I invite you to acknowledge our first co-moderator, Professor Naima Amrani. Professor Amrani was president of WGO from 2019 to 2021. She was, in fact, the first woman to hold this position and the first president from Africa and Middle East. She also served as director of the WGO Rabat Training Center in Morocco. It was under her presidency that the WGO formed this climate change working group, nowadays, during this term, transformed into the Climate Change Committee. We also have as co-moderator Dr. Jennifer Christie. Jennifer serves as clinical director in the Division of Digestive Diseases at Emory University in the United States. She's currently the president of the American Society for Gastrointestinal Endoscopy, and ASG joined with 3 other major GI societies, HGA, ASLD, and ACG, to release a multi-society strategic plan outlining goals and milestones the GI specialty needs to achieve to reduce the environmental impact of the practice. I am also pleased to present you the 2 speakers, Dr. Rebecca Philipsborn. Dr. Philipsborn is a primary care pediatrician at Emory University in Atlanta, Georgia, teaches as an assistant professor in the Emory University, and is a clinical consultant with Emory's Global Health Institute. Before becoming a physician, she was a healthcare management consultant in New York and worked at the West Africa Regional Bureau of the World Food Programme in Dakar, Senegal, on maternal and child health and nutrition. Her scholarly work focuses on global child health and mortality and climate change in practice and in medical education. Dr. Philipsborn brought this global perspective to her work against the climate crisis, saying the health of people and the planet are intertwined. Also, we have Professor Aasma Shaukat. She's affiliated with Division of Gastroenterology and Hepatology at NYU Langone Health in the United States. Dr. Shaukat has published extensively, as you know, on colorectal cancer screening, prevention, and quality indicators for colonoscopy. She also serves as the chair of the WGO Young GIs Committee, which brings together a group of young gastroenterologists, hepatologists, and endoscopists who work together with WGO to identify and manage the key issues affecting the specialty, including climate change. So let's begin with our session.
Hello, and thank you so much for having me. I wear many hats, but today I'm representing the Young GI. I'm the chair of the WGO's Young GI Committee, and I'll be speaking to you about the perspective of what the young GIs are thinking and doing for this really important issue that we're all very passionate about. So engaging and empowering trainees and early career GI providers. So I'll review the connection between GI and climate change. This will be a recap for most of you, given our excellent webinar series. But then the importance of climate change to young GIs and some surveys we did in our own group, some case examples of leaders in this field, and then leave you with some conclusions. So in terms of introduction, climate change, as we all know, poses significant threats to our planet's ecosystem, public health, and our well-being. We as gastroenterologists have a unique opportunity to make a positive impact. We can do this through our clinical practice, education, and advocacy. And you can see in this Venn diagram how this might be all related. So let's take a deeper dive into this. In the US, we recognize how important our role is in climate change. The healthcare sector generates about 8.5% of greenhouse gas emissions, and 7 to 80% come from the supply chain linked to using instruments and supplies. These are things we use in clinic and endoscopy, particularly specialties like ours that are endoscopy heavy are a major contributor to these emissions. Endoscopy is thought to be the third largest generator of medical waste, and our per procedure carbon dioxide consumption is about 20 times greater with single-use instruments versus reusable instruments. And then we've all seen these waste bins fill up with single-use devices after every case or procedure. Multiply that by hundreds and thousands of procedures that we do. These are all things that are destined to end up in the landfill. So we do realize that this situation is not sustainable and we need to be taking some action. Well, the WGO has great leadership, and we welcome this survey that was done recently and was reviewed on previous calls. But it's a survey of global gastroenterology society leadership about, so this is what our leaders are doing and thinking about in terms of climate change. The 117 GI societies surveyed over 108 countries. And on a scale of 1 to 100, the level of crisis was identified at 86. However, there was some inertia or barriers to putting this as a priority that was rated only 36 on a scale of 1 to 100. And even though societies and leadership believed that human activities are causing the climate change crisis and we will need to do something to decrease, it wasn't a pressing issue. So between the concern and action, what stands are three major barriers: financial barriers, systemic barriers, logistics, and overcoming some of weighing our needs versus the waste that it produces. And then just psychologically coming to terms with how important this is and making it a priority. So this is where I'll frame it. So within our Young GI group, we have a very robust section of almost 20 members, and they represent all geographic areas around the world and different specialties. So we've done a few discussions and group surveys, and I'll summarize the results of where we think there's need. So overall, there is growing awareness. So members of our group recognize the importance of adopting sustainable approaches to mitigate the impact of environment and rated it as a very important issue that they think about. They would like to support sustainable practices. We understand the potential benefits of waste reduction, energy conservation, but we have a desire for education and guidance. And most of our members, majority expressed a strong desire for more education and guidance on how we could implement sustainable practice in our clinical settings. And then we also discussed barriers to implementation. The common challenges were we don't have a lot of say in kind of the instruments and the disposable equipment we are given. Would this be at the risk of patient safety? And are there very many effective eco-friendly alternatives out there that we could pick from? We also emphasize the importance of leadership and collaboration. We'd like to see our society leaders take a lead in this, but also collaborate with other major movements in driving sustainable initiatives. So that's where we look to healthcare organizations and regulatory bodies to provide us guidance, maybe make policies that make this movement easier to embrace. We talked about sources of waste in endoscopy, and it was very interesting. Our members were able to identify pretty well where a lot of the waste is generated. A lot of it is these single-use medical supplies that we use on a daily basis, things like biopsy forceps, brushes, snares, dilators, and catheters. And we discussed to the extent of being able to use reusable equipment. The packaging material, so in the interest of sterile packaging, there ends up being a lot of waste for everything we use, including the wraps and the containers. And then the cleaning and disinfection supplies obviously have an impact. And then paperwork, to the extent possible, we should be trying to use electronic means and not be using extra paper that goes to waste. So to summarize, our perspective on this was, how can we get more education? We need more research. We'd like some innovative solutions. We'd like guidelines to give us kind of the impetus to be able to implement these things. We'd like society leadership to encourage us. Some incentives for practices would be very important. And we'd like to see advocacy on a global scale help us achieve these goals. So we talked about the practical ways to mitigate some of the impact of the climate change. So we can definitely adopt some of these things in our practice. To the extent possible, reduce, reuse, and recycle. So these are the basic principles, but in the next slide, I'll summarize how we can practically apply them in our practice on a daily basis. So the first thing is to avoid procedures that do not need to be done. In the US, this is particularly a problem that's been identified through multiple studies. So low value procedures that will unlikely change management or benefit the patient, preventing those from happening itself is very powerful. Then planning ahead. So if there's a case to be done, knowing what instruments will be used, and only open up things when they're needed, as opposed to having a lot of things pre-opened and ready to go. Following guidelines from society and leadership about being environment stewards, and finding like-minded individuals in our endoscopy units and starting a green team. So getting some reinforcement for what we're trying to do. So in this regard, we also look to see what some of the major global societies are doing. And this was brought up by one of our members. This is a very comprehensive document, one of many. And this is by the European Society of Gastroenterology Endoscopy and Nursing Association. And it's their position statement on environmental footprint of endoscopy in particular. It's a very detailed document. It has 39 recommendations. But what we took away from it is the most effective way to reduce GI endoscopy is to limit unnecessary procedures. We should be able to adopt the reduce, reuse, recycle programs. Endoscopy units should establish local policies and environmental educational programs. We should discourage the use of routine use of single-use endoscopy and endoscopes, except for really highly selected patients. We would like there should be some virtual training and online education that tells us how we can have a lower impact on the environment. And then GI endoscopy companies should assess, disclose, and audit the environmental impact of their value chains. And GI endoscopy should truly become a net zero greenhouse gas emission practice by 2050. So some lofty goals, but again, things that we should be doing because of the urgency. So Professor Macedo nicely mentioned the multi-society joint publication. And again, referring to all the major GI and liver societies in the US that have come together on this multi-society joint publication on environmental sustainability and a strategic plan. And in this slide, I've summarized the overall vision is providing digestive health, but then also taking care of our planet health. And it goes over a lot of these domains that were discussed earlier, where a lot of these efforts can take place. So this was highly welcomed, and these are the kinds of things that we as young GIs are looking for. There's another excellent document, and here I've provided you the reference. And it kind of breaks down, goes into detail at each step in the endoscopy unit, where we can think about green endoscopy and reducing our environmental impact. So I won't go through this entire slide, but you can see there's multiple opportunities for us to reduce our carbon footprint and be able to do our work effectively while reducing the environmental impact that we have. So in terms of research and innovation needs, what we identified was development of energy efficient endoscopic equipment. So, we identified that there isn't equipment that we can choose from that consumes less energy, and this would be a great area for future research and innovation. Perhaps imaging technologies, light sources, sterile processes that minimize energy consumption without compromising quality. We talked about sustainable packaging solutions. Perhaps research could be directed towards developing eco-friendly packing material for endoscopic accessories and supplies, such as biodegradable or recyclable packaging product, reducing the packaging itself, and utilizing sustainable materials in the manufacturing process. And then finally, a carbon footprint assessment tool. This would be a great tool to have for our GI practices, something that tells us where we score relative to a goal and other benchmarks that we could work towards achieving. Other needs were waste reduction strategies. As I showed you that bin that fills up immediately, how can we develop waste reduction strategies that tailor to our GI procedures, such as single-use medical supplies, optimizing inventory management to reduce waste, and identifying opportunities to recycle and reprocess. And then green endoscopy unit design, such as the diagram that I showed you, it'll be great if we see that integrated in our endoscopy units. In terms of collaboration and partners, so the major GI societies and associations are our partners, but we also felt healthcare institutions, medical device and equipment manufacturers, pharmaceutical companies, nonprofits, research institutes, and patient advocacy groups all need to come together if we're going to truly make some effective changes. And in terms of role of industry, we felt a lot of responsibility could be laid on them to design eco-friendly medical devices, sustainable product design, managing their supply chain so that it reduces the carbon emissions, collaboration with us healthcare professionals in getting feedback on sustainable products that are also environmentally friendly, advocacy and policy engagement by our industry partners, and transparency and reporting. Basically, a commitment to sustainability by being transparent in their environmental footprint. So next, I'd like to highlight a young GI, and these are the kinds of examples we want to highlight and hopefully emulate. So this is Rabia Latour. She is one of my colleagues at NYU, and she's a gastroenterologist who's passionate about reducing the environmental impact of GI and endoscopic procedures. So she took it upon herself and did a lot of effort on this. And some of her domains of effort were in equipment reprocessing. She assembled a team of like-minded individuals, got buy-in from leadership at Bellevue Hospital, and her team ensures that all reusable equipment, such as biopsy forceps, are properly reprocessed and sterilized to the extent possible for reuse. They work with endoscopy unit staff to ensure reprocessing guidelines. They put a process of waste segregation and recycling, again, encouraging staff members to participate. They work with the hospital administration to make recyclable material and friendly plastic packaging available and reducing waste. And then also work with the hospital to establish a recycling program and many other efforts that she's done. And these are ongoing, but she's been acknowledged for her efforts. She is now named as the first ever Chief Sustainability Officer at a public county hospital in the US. And she's been the recipient of several scholarships, a White House fellowship, and she founded a group in 2018 and continues to focus on the hospital's carbon footprint beyond endoscopy and in other places in the hospital. And she's also the representative to the MSTF white paper on sustainability in GI. And you can see she's been to the White House and met some very famous people. So, these kinds of efforts really need to be rewarded, encouraged, and then emulated in other practices. So in conclusion, GI contributes to climate change through energy consumption, waste generation, and greenhouse gas emissions. It is crucial for us as gastroenterologists to acknowledge these environmental impacts and take steps to mitigate them. And essentially breaking that cycle where we see the link between climate change, health, and then put in some resilient practices to achieve those goals. So this is my final slide. It takes individual, community, and healthcare resilience to achieve green and sustainable care. And future research, there are a lot of needs. We need to understand environmental aspects of care beyond just cost and efficacy. How could we provide high quality care while being environmentally sustainable? What is our carbon footprint? What standards should be ascribed to? Are they implementable? And what are the barriers and how we can overcome them? With that, I'd like to thank you. And again, a reminder that we're doing this because the future is the next generation and the generations after that. So that's who we have a commitment towards. Thank you so much.
Thank you, Aasma. It was a fantastic talk, very balanced and very, very informative. I have to tell you that our audience should be keen to participate. So please put your questions on the chat, and don't forget also that these webinars will be available, and they are available already, and they can be attended and shared later on from our website and soon, hopefully, from our WGO Academy. Very well done. Thank you very much. And we are now moving towards the next talk on climate crisis, a global pediatric health perspective from Dr. Rebecca Philipsborn.
Hello, I'm Becca Philipsborn. I'm in Atlanta, Georgia, where I work at Emory University in Children's Healthcare of Atlanta. I'm so honored to be part of this series, and I've learned a lot about GI care, endoscopy, how we can reduce our waste. And today I'm going to talk about children and the climate crisis. As a general pediatrician in my day-to-day job, I get to see all of the potential of children, and I think it's up to us to protect that potential. This quotation from the 2019 Lancet Countdown on Climate and Health really is what keeps motivating me to stay in this space. It will take the work of all of us, the 7.5 billion people currently alive, to ensure that the health of a child born today is not defined by a changing climate. We have to act. In 2021, UNICEF released this report calling out that the climate crisis truly is a child's rights crisis. The report details the myriad ways that climate change erodes child's health. And this graphic illustrates that almost every child on Earth, greater than 99%, is exposed to at least one climate shock or stressor. We've heard from Dr. Costello already about some of the specific ways that climate change affects children, and I'll hope to build upon those themes today. We've also heard about migration and displacement from Dr. Macaria and how much this can affect specifically maternal and child health, this exquisitely vulnerable period when climate shocks and stressors can disrupt perinatal care and so much more. And increasingly, our children are seeing these climate shocks with their own eyes. How do we protect their health and their mental health when they are living this every day? So these pictures are from the town where my mother-in-law lives in Red Lodge, Montana, nearly 1 year apart. And you can see the multiplying stressors that this town of Red Lodge, Montana has faced. June 15th, 2021, fires creeping right up to the town's border. June 13th, 2022, where rapid snowmelt from the mountains caused overflowing rivers. And this bottom picture is not the riverbed, that's the main street of town. Increasingly, children are actually seeing these stressors. And while we and the medical community have worked really hard to message that this is absolutely a health problem for us, for our children, for our families, when I ask children what they want me to message back to you guys, they want to make sure that you know that they actually do care about the polar bears too. They care about biodiversity loss. It affects their mental health that our species may be responsible for the loss of so many more. They actually care. It's no surprise then that youth mental health is affected by this in so many ways, not just from loss of place, loss of home, but from anxiety around this complex problem. This multinational survey of 10,000 youth aged 16 to 25 in 10 countries found that almost 60% were extremely or very worried about climate change. I know the graphic is small, but that's those red and orange bars there for all countries combined. And then that blue bar on top indicates that 45% of these youth felt that feelings about climate change negatively affect their daily life and functioning. In the report, you can see data across countries, and the trends holds to different degrees across our different countries. At its heart, climate change is a question of social and intergenerational injustice. Those least responsible for the crisis are those most at risk. And I know this graphic may be familiar to many of you. It's old now, it's from 2007. The top is showing relative contribution to global CO2 emissions, and the bottom, where you see different areas shown bigger than they are in actuality, is showing relative mortality, so not just morbidity, but mortality from just 4 climate-sensitive conditions: inland and coastal flooding, malnutrition, malaria, and diarrheal disease. And you can see that these graphs are essentially the reverse of one another. Those least responsible are most at risk, and this includes our children. It's worth pointing out too that inequities exist on a micro scale within our neighborhoods as well. These are manifest in our communities, and addressing climate change is partly how we can help address some of these inequities. Our children want us to know that they think we'll die of old age and they will die of climate change. The Fridays for Future movement is picking up speed around the world, and children are absolutely out there telling us that we must act. We need to elevate their voices and listen to them as we move forward. On the global scale, climate change threatens reversing really remarkable progress that we've made as a global community in reducing mortality for children under 5. So this pie chart may be familiar to many. It's showing causes of child death, where in the yellow are those causes of neonatal mortality, so children 28 days and under. And on the left side are deaths among children aged 1 to 59 months old. And what we can see when we break this down is that climate change and all those risk of climate change, direct and indirect, that we've learned about through this course are a lever on these causes of child death. Extreme heat is a teratogen. It increases risk of preterm birth and congenital anomalies and complications from preterm birth. In the GI world, I think about our children who are born prematurely and what a risk factor that is for gut dysbiosis and potential necrotizing enterocolitis, for example. We have poor air quality, which can magnify some of these effects on preterm birth, and is also a risk factor for pneumonia, which is a leading cause of death in children aged 1 to 59 months old. Extreme weather conditions contribute to displacement and can disrupt our water, sanitation, and hygiene systems, increasing risk for diarrheal disease as well. And then we have our vector-borne illnesses, these changing patterns of infectious diseases that can contribute to malaria and much more. So this is not an exhaustive list of how climate intersects with causes of child mortality, but I want to emphasize that climate change is a lever here on preventable causes of child death, and we must act. You may recognize what's missing from this chart, and that, of course, is malnutrition, which can affect nearly every cause of death on this chart and is of such importance to GI health. So our opportunity here today is to combine our voices, and I would encourage you as you move forward to center our children's needs and our global response to climate change. We know that in 2017 we passed the 1 degree Celsius mark of warming globally, and we know that the Intergovernmental Panel on Climate Change has laid out our task to mitigate. We must reduce carbon emissions to, quote unquote, avoid the unmanageable. But we know that we're already stuck with some of the implications of climate change, and we also have to adapt to manage the unavoidable. When we center children's needs, what this means is reducing child exposure risks by mitigating emissions. We're reducing the ultimate harm that our children may face from climate change, and by adapting, we're helping to protect them. This means we can save child lives, prevent child illness, prevent disruptions to childhood itself, from school disruptions, loss of home, support child rights, and promote health equity. So that's the global picture, but for those of us who are clinicians, how do we really bring this down from a population level into a clinical setting? And I know we've already heard about the specific risk of climate to health, and I don't want to just re-emphasize those, but I do want to emphasize that they are profound for children. And this framework helps to show why. And this is a framework that you can use right there in your clinical setting for an individual patient, adult, or child in front of you. So an individual's vulnerability is going to be a composite of their exposure risk, their physiologic susceptibility, and their adaptive capacity. This is how we teach our learners too at Emory to assess environmental exposure risk. So for children, they are all more vulnerable to climate and other environmental risk factors. They breathe closer to the ground, their activities, their interface with the outdoors and the natural environment increases their risk of exposure. They are all more susceptible because they are still growing and developing. Their physiology is different. They have greater surface area to volume ratio. This makes them more susceptible physiologically. And in terms of adaptive capacity, especially the youngest children are completely dependent on us, on the resources of their caregivers and their community to protect them. If a newborn overheats, for example, they can't even remove the cap on their head to help cool off. So this framework can help us bring these big implications of climate change right into a clinical setting, and we'll talk through a little bit more how this can work. I think when we're in clinic, it's important to remember the cultural backgrounds of our patient and make sure that we are in a clinical setting centering the needs of that patient, that child, how climate change is affecting them. So let's look at exposure risk. This can be a function of geography. Those who are on the coast where it's more prone to flooding are going to see more of the increase in diarrheal disease that we have heard can be associated with increased temperatures and flooding driven by climate change. Neighborhood can be a factor, the status of water, sanitation, and hygiene systems. The occupation for older children or the activities of younger children, say participating in sports, for example, is going to make them more at risk for heat-related illness. And some of the activities that we are starting to see affect children in the climate crisis are a little bit more unexpected. So this is an environmental health article from a while ago, back in 2017. And this is looking at the risk factor that splash pads pose to diarrheal disease. And they found that 1 in 5 of the samples tested at these so-called splash pads where children go to cool off from extreme heat had bacteria that could cause diarrheal disease. About 20% of the children on the splash pad, about 20% of the children there were in diapers, and about 20% of those had diapers changed in the splash pad area. So I bring this up because it is one of my favorite quotations from a medical journal article here, that among the patrons observed, common behaviors included sitting on the fountainhead and putting the mouth to the water, because of course these are babies. But we have to ask the right questions when we're there in a clinical environment about what environmental exposures our patients have been facing. We have to update our practice for some surprising findings like this one, those expected and unexpected emerging risk ahead to the climate crisis. Some of the things that we do to adapt, like use splash pads to cool off in extreme heat, may actually lead to things like diarrheal disease if we're not careful in taking the right precautions. When we look at physiologic susceptibility for our patients, and these are some examples specific to the GI world, this is not an exhaustive list, there are things that you may see in your patients that increase their susceptibility, like existing malnutrition, if you've prescribed laxatives or medications that may alter their ability, their water homeostasis. children or adults with chronic gastrointestinal conditions. And I was thinking here like short bowel syndrome. And then those who are dependent on tube feeds or any special formula. In that last category especially, those children really need to have a disaster preparedness plan in place. If they are in the path of a climate-driven disaster, what is their plan to access those special nutrition needs that they have? And how will they ensure that their care is not disrupted, especially when their life depends on it? Adaptive capacity here, again, with this GI lens, is making sure that we have robust and resilient community services and resources. Even in the COVID pandemic, we've seen how our food supply systems can be disrupted. We've had really profound formula shortages here in the US, where babies were coming to the emergency room simply because their parents had gone to many stores and could not find any formula on their shelves and were not able to feed their child. We need to continue our support for breastfeeding here and make sure that children have access to school food and nutrition programs, and that when school is disrupted, there's some plans for continuing these programs where children get a lot of their daily nutrition. And then we need to make sure our patients, especially those who, again, their life depends on a daily medication or special medical equipment, have a disaster preparedness plan and know how to access public health alerts. Here's some examples of public health alert that we can use in our clinical setting. This one is from CDC and talks about drinking safe water, what to do, how to access public health messaging. When we have boil water advisories in the US, we need to make sure that our children, that our families know how to access those, and globally making sure that our families know how to access safe water, that we have water, sanitation, and hygiene infrastructure is of course so important. This is the potential synergy for continuing progress in reducing global child mortality and addressing climate change. And of course, at the broadest level, we need to continue to advocate for improved funding for existing resources, all the ways that this intersects with what we're already doing in global health and child health, and advocate. No matter how much we do in our clinic, there's going to be more to be done on a global scale, so we need that big systemic change. I want to take a minute to talk about the elephant in the room here for GI care, and that's diet, and that red meat accounts for about 30% of greenhouse gas emissions from our food production chain. This key finding from the Lancet Countdown showed that decarbonization could prevent 842,000 deaths associated with excessive red meat consumption, and that there is such synergy between what we need to do to reduce carbon and what we need to do to support our health anyway, those health benefits of climate action. We know that plant-based diets are not only good for us and can reduce our risk for many chronic diseases, but are also associated with less CO2 emitted. Dr. Pohl earlier in the series emphasized that the best way to reduce waste in healthcare is to not need procedures and not need medications in the first place. Plant-based diets are one way that we can make that switch. The Eat Lancet Commission on Planetary Health Diets convened experts on this topic, and they concluded that food is the single strongest lever to optimize human health and environmental sustainability on Earth. This is great news for me as a primary care pediatrician, because I talk about diet and nutrition in every single well visit, every single time I see a patient in clinic. So this report tries to answer the question, how do we achieve diets for the global population that provide the nutrients that we need to support our health while also staying within planetary boundaries? And I would encourage you to check it out. They found that globally, transformation to planetary diets is going to require substantial shifts, and these shifts are different for each region. So in the top right, no surprise, you see that in North America, we exceed that planetary health and human health boundary, that dotted orange line, substantially for our intake of beef. And we don't eat enough of some of the other things that are good for us. This compares to South Asia, where we still have a lot of malnutrition and we need better access to these healthy and nutritious foods. So this is showing the diet gap between global current intakes in these different food categories and the optimal intake per the Planetary Health Diet. This also makes clear that we need to double down on our support for prevention of food security and nutrition programming globally. So what does this mean in clinic? Our dietary counseling in the era of climate change. We can meet our patients where they are. We can stop medicalizing being a vegetarian here in the United States. If families want to be vegetarian, we can talk to them about how they can meet their nutrient needs for children with that vegetarian diet. In my clinic, I break it down to the actual nutrients, macro and micronutrients, and talk about those. So the message is no longer you need to drink milk to get your calcium and vitamin D, but it's you need to get your calcium and vitamin D. So let's talk about how we can do that if you are choosing not to drink dairy. We can meet our patients where they are. I know that sounds very simple, but we haven't done that for a long time. We can partner with our nutrition colleagues. We can update our guidance for children and adults with what we know about how important it is that we feed ourselves today without compromising our health tomorrow. And then we can mirror these guidelines in our public health programs, like school food, in our hospitals, how we provide nutrition in the healthcare setting. So bringing this together from the clinical perspective, climate change can be part of your day-to-day routine. You can screen for environmental health exposure risks, include this in your management plans, think about how you promote health and not just prevent disease. Think about this if you're discharging a patient from the hospital, how are they going to access care if they need it if you're in an area prone to climate disasters? Focus on your anticipatory guidance to help protect your children, your patients, your adults from climate risk in your area. It has to be local, and you will know those local risks more than your global colleagues. Use specific billing codes when you can so that we can aid our public health colleagues in calculating the burden here. And then we need to continue to raise our voices in advocacy for community resources. And just spending a minute on curriculum, since we're talking about that today, how can we do this in curriculum? I had the joy of collaborating with colleagues to pull together some guidance for residency education, how we can talk about everything we just talked about and more, what we need to do and teach it to our trainees. And my one message here would be partner with your students and residents. They are amazing resources in this space. They are motivated. In many cases, they know more than their attending physicians do, and they can be fantastic partners. This is my residents doing a food waste challenge, how they could motivate our Department of Pediatrics to reduce food waste. And they helped host a week on this topic of planetary diets for our department. These are some of the many med students and residents who've undertaken projects from doing waste audits in our ICU setting to completely co-creating the curriculum with me at Emory to many, many more. There are lots of resources to support you in planetary health education now. And in conclusion for today, we can start now, start today. Listen to our patients and children, elevate their voices, recognize and address climate-related illness in your clinical setting. We need to be part of adaptation, and that means preparing our patients, our students, and ourselves for these threats, and promote healthy, culturally appropriate plant-forward diets in your practice to really lean in on those health benefits of climate action. You can use your power in whatever realm you have power, clinical, administrative, research, and otherwise, to bring climate change to the table. And if you're already talking about climate change, please consider child health risk too. You can take stock of your own food, transportation, energy, and other purchase sources and choices. We've heard a lot about that already, and we need to continue to advocate for that big picture change. So I challenge all of you to make a commitment today to something that you can do to contribute to a healthier and more sustainable world. Those small commitments add up. Thank you so much.
Great, Rebecca. Really enjoyed your talk. Very comprehensive and an outstanding presentation. Very impressive in many aspects that you've shown us. And well, just for a kickoff, before sending you over to our moderators, perhaps one question for each presenter I would like to make. And one thing that struck me about what Aasma mentioned earlier was that, yes, we need a green champion everywhere. And your example was extremely good. How can we, let's say, challenge, and how can we create some energy, good energy to our youngsters? Can we point them that there's a tremendous gap in knowledge in terms of research about this issue? What are your thoughts on that?
Yes, absolutely. All those are extremely important. And some of it will be, from work that Rebecca just presented, making curriculums, making them part of our standard training, and emphasizing that we care about these things. The other thing the young GIs want is they want to feel empowered, and that comes from leadership. So they recognize that they would like leadership to, create these positions. If they want to take on the initiative, then reward them and give them the resources as well as a team structure so that they can be successful in some of these efforts. So I think it's, nothing happens in isolation, but it's a commitment that maybe perhaps, bubbles up from the young GIs, but then needs a lot of leadership support and support from other committees in the hospital.
Correct. Very good. And you're totally right. And as we are passionate about education, positive feedback is something that we always need. So that's a very important note that you've just mentioned. Rebecca, I was really impressed with what you told about the awareness and the consciousness of kids. They know much more about this than we do, in fact. How about the parents? Can we use the parents as, let's say, not an innocent bystanders, but someone who can provide the good message for everyone?
I think that's a great idea. Thinking about how we can use parents to message what they're seeing for their children. I think that's a fantastic idea. And sometimes the kids are the ones who are first bringing the message home to their parents because they're learning about it in school or otherwise. And then they are educating their parents who are then becoming activists themselves. So we've seen this happen. And I think it's great. One of the things I love, to build on what Aasma said, for our trainees, for our children, they're not used to the way that we've always done things like we are. So they see the opportunity in a way that's different than how we see it. They're not immune to the piles of waste that we create in the hospital. The first time they see it, it really strikes them. And so using their new perspective and their innovative ideas gives us a way to move forward that maybe we haven't thought of. So they really are coming through the system, and in some cases looking for that big systemic change in healthcare. Just fantastic.
Great. Thank you. Well, it's time for our moderators. So I would invite Naima to come up and make some comments and reflections on any question that you want. Go ahead. Yes, you're muted, Naima. You're muted. Please put your head. Yeah.
Okay. So good. Thank you. I am very happy to participate at this session and would like to thank our two speakers for their wonderful and inspiring talks. My first question is for Aasma. Aasma, you have given us very good talks, inspiring and rich on information and advice. As the chair of Young GI Committee, how could you support the integration of training for GI about climate change? And what are the different steps you will use if we introduce at WGO this education about climate change?
Yeah, those are excellent points. And, I'd love to hear feedback from others on the panel. But having curriculums and integrating them as a mandatory part of our training, and perhaps, in different modules or, different levels that we can continue to reinforce with our trainees as they progress through some of their training. And then we also need to make it really visible that we are looking at, say, sustainability scores, such as, that wonderful diagram of the endoscopy unit, and knowing that trainees are a big part of it. So they should be aware at what's happening at different stations, and also be aware of the waste that's being produced and how ways to mitigate that. So that would be essential education for everybody that is, say, in an endoscopy unit or in a clinic. Because, and then eventually we need research that ties it to outcomes such as patient safety, reducing our carbon footprint, so that we know that the efforts that we're making are actually having an impact. So I think we're starting to take baby steps towards that. There's definitely a lot of enthusiasm. So I think we just need to put in some of this curriculum and that structure to really make it come to fruition.
Okay. Thank you. Maybe another question about endoscopy for you, Aasma. Should we understand that you are inviting us to come back to what we used before? You understand what I mean? About to reuse the same material. And so this is what we were doing before.
Yes,
and
absolutely.
Now, with the problem of climate change, are we, should we go back to what we were doing?
So I'm not sure that we can entirely go back, and then reprocessing, sterilization, that also uses, a lot of energy in the disinfection and the cleaning process. And frankly, we do have to keep patient safety and infection risk in mind, and some things we'll never go back to. I mean, disposables do have, that unique advantage. So, but what we can do is a bit of both. So to the extent possible, go back to things that can be reprocessed or reused, but then also think about the disposable things and how we can either make all those, extra things that come. So for each catheter, there's, so much packaging and extra plastic sheets. So is there any reason why we can't reduce some of those plastic sheets? I remember, the clips that have the long plastic sheet that we would just take out and throw away. So is there any reason that we can't, not have that plastic sheath and just have the clip by itself, for instance? Making the packaging material that's biodegradable or reusable, so that if we are using that plastic sheet, maybe it could be reused, for a different purpose. So that will definitely require, some system redesign, and that's where we need our industry partners and, frankly, some regulation around it, or some kind of mandates or sustainability scores that we are trying to achieve and exceed. Similar to how we develop the field of, quality indicators for our GI procedures. So I think it's going to need this kind of multifaceted effort.
Yes, thank you.
It was a provocative question for us.
Thank you, Naima. Can I bring Jennifer in? I'm pretty sure that she wants to make a comment on these talks and a provocative question. Why not? Go ahead, Jennifer.
Yes.
Go ahead.
Thank you. Happy to be here, and thank you, Aasma and Rebecca, for very inspirational and thought-provoking talks. My first question is for Rebecca. You mentioned that it's important for us as healthcare providers to kind of meet our patients where they are, and so addressing health and climate change and eating healthy from a culturally sensitive perspective is key. How do you suggest that we do that? Because a lot of us don't know how to do that and can't really associate or understand what different cultures or environments are dealing with. So is there some strategy in which we can become better educated to do that in a more effective way?
Yeah, thank you so much for that question. I really appreciate it. And I think there's so much that has been made of us as healthcare providers as trusted voices. And I like to tell our students and my colleagues that really we should be trusted listeners. We can listen to our patients first and learn from them, learn about their cultures from them. And in Georgia, I had the privilege of working in our refugee and immigrant care clinic for a long time. And that is the approach, listening carefully, asking thoughtful questions to understand without judgment what families are going through. And I think a lot of primary care providers do share culture with their patient community right there locally too. And so we can share that perspective with them right there in the clinical setting. I also think our dietitian colleagues are a huge part of this, and we do have limited time in the space of a clinical visit. So if we're able to ensure partnerships with nutritionists, with dietitians, they can help us continue to educate our patients and families as well. For now, I think the example there is we have more families actually in clinic who are coming to us and saying that they don't want to drink milk anymore. There's a lot of non-dairy milks. And I think historically the answer was, those milks are not really milk. They're kind of like nut juices and don't really provide the same nutrients. But the second part of that message doesn't need to be that our families need dairy. It needs to be they need the nutrients. They need calcium and vitamin D. They need the right balance of fat and protein. Let's meet them with what they would like to do in terms of their diet and help support them in those choices. And for kids, a well-planned vegetarian diet can supply their needs. So let's make sure we empower our families in that planning process.
That's excellent. Thank you. I think that listening piece is key. I want to bring in a question from our audience. The question, and Aasma, you kind of touched on this a little bit, but if a disposable product that is made of renewable material like bioplastics gets recycled after use, can it be considered more sustainable compared to a reusable product that only contains non-renewable material?
Yes, absolutely. And that's a great way of kind of thinking about the kind of products we'd like to use. The only caveat there is we still kind of want to reduce the amount of material we use or the amount of packaging or coverings it has, because we'd like to believe everything is reusable and recyclable, but not everything is, and that also uses energy to recycle. So again, we still kind of need to be conscious about how much packaging and equipment it comes in, but having it made of renewable or recyclable material, reusable material is definitely the way to go.
Excellent.
Great.
And it,
Yeah, go ahead, Jennifer.
yeah, I was going to bring in another question from the audience. The question is around the disturbances in the composition of the intestinal flora, i.e. dysbiosis, and it plays an important role in the etiology of IBD. So I don't know, if Rebecca, you can comment on that. You touched on it in your talk, but maybe expand a little bit more on what we can do.
Sure, I read through that question and really appreciated it, because I think the question is its own answer in a way, and it continues how much our diet, the composition of our diet, affects intestinal flora, and that how intertwined this issue is of our food production, supply, consumption, and GI health. And I think there's a lot of, through this series, we've talked a lot about GI procedures and addressing GI illness, but I appreciate the attention back to a solid foundation for GI health and that flora, intestinal flora. So I will just thank the audience for the question.
Yeah, absolutely. And I'd like to add, the global pandemic that we're seeing of rising incidence of colon cancer, among other things, in younger individuals, we think is related to a lot of dysbiosis and changes in the microflora that are leading to obesity in children, adolescents, and the risk that they carry into younger years. And then also, NAFLD. So that I think is going to be our next global challenge.
True, totally true. And as you see, this is an ongoing, emergent, and urgent topic that's we mentioned just in the beginning. And just before finishing this session today, I need to thank the speakers and the moderators for their so important contribution, and remind all of you that there is still one more session to go before the end of this mind-blowing course, which will illustrate a very positive and insightful view for the future to where we can build a brighter and sustainable way of life while doing what we like to do the most, which is taking care of digestive health. So don't forget, from our final episode on the June 28th, session 9, Building a Brighter, Sustainable and Better Future. Thank you very much for attending, and thank you all for being here and providing this wonderful webinar. Thank you.
Thank you.